Hello class, I'm here to give a speech on female genital mutilations in Nigeria, called FGM. What is female genital mutilation? According to World Health Organization, female genital mutilation, FGM, comprises of procedures that involve partial or total removal of the external female genitalia or other injury to the female genital organs for non-medical reasons. Sources report that the prevalent rate of FGM among adult women in Nigeria is 77% in the south, 68% in the southeast, and 65% in the southwest. This was reported by IBID Leadership 6 February 2016, Bergen Magazine 19 February 2014. At this moment, I want you all to close your eyes. Imagine a blade. I want you to run your finger across the blade. Do you feel the sharpness of it? Does it cut your finger slightly? Is there a bit of blood at the tip of your finger? That's all normal. Now imagine being pinned down to the ground by your parents, and imagine that same blade slowly creeping between your legs. You feel it touch you. You're yelling, screaming, begging for someone to help you, and then it happens. You can open your eyes. Due to this, the women in Nigeria are unable to live like normal women and are not given the right to the well-being of their own body. Therefore, as citizens of the world, we must provide awareness on this topic and help to decrease the number of women suffering from this epidemic. This is the natural external female genitalia before being mutilated. We have 4 stages of female genitalia mutilation. The first one is often referred to as clitoridectomy. Type 2, often referred to as excision. Type 3, often referred to as infibulation. And type 4, pricking, piercing, incising, scraping, and cauterizing the genital area. This is an image of the FGM type 1. Is a model of FGM type 1. This is when part of all of the clitoris is removed, or part or all of the hood of the clitoris is removed. This is the part type 2. This is when the clitoris and the inner lips, the labia minora, are removed. The labia minora are removed here. Let's go back to the first one and see the difference between the type 1 and type 2. The type 1 still has this in there, that is, part of the hood of the clitoris has been removed, and this is the normal genitalia. Where we have the clitoris is still normal here. But from the picture, we can see that when we go to the type 1, we see that the clitoris has been cut, has been mutilated there. Then to the next one, which is type 2, we can see here that this has healed up. Then there is no labia minora. It has been totally removed. Then go to part 3, the type 3. This is the most severe form of FGM. Here the clitoris and inner lips, labia minora, are removed, as well as part of the outer lips. The outer lips are then sewn together and heal as scar tissue. These are what our ladies, the women that undergo genital mutilation, this is what they suffer. These are what we use. These are what they use for the mutilation in Africa. You see the blade, the knife, the scissors, the razor blades, some type of sticks, and this sharp object. This is another type. These are herbs, the native herbs. This is a kind of seed, and these are sharp things, and these are a kind of stick to hold the clitoris before being mutilated. This is a child undergoing genital mutilation. You can see this is going to be painful. These are traces of blood. The child is undergoing serious pains. There are several complications after the mutilation. The first one, which is immediate, is severe pains, excessive bleeding, genital tissue swelling, fever, infectious, e.g. tetanus, urinary problems, wound, healing problems, injury to surrounding genital tissues, shock, and death at times. We have long-term consequences, which include urinary problems, vaginal problems, menstrual problems, sexual problems, increased risk of childbirth. Long-term continues here the need for later surgeries, psychological problems, health complications of female genital mutilation. Now, this type of mutilation has serious effects on the psychology and the sexual appeal of women. This has to be rebuked by everybody. Therefore, as citizens of the world, we must provide awareness on this topic and help to decrease the amount of women suffering from this epidemic. We must provide awareness for those 77% of Nigerian women who are not able to do so for themselves. The truth is, we are hardened human beings with hardened hearts. I said this because I know for a fact many of you will walk out of here today unchanged and unwilling to take action. For those of you who has the intention of changing this wickedness against women, against female, we should come together and support the action taken by WHO. Thank you.